Welcome, PowerPoint 1.6. This is going to explain a little bit why our office is unique. Some things are a little dated, but if you are watching from an outside perspective, then it's more about what your office is. And since we work with a lot of pre-dental students, my question to them is that you will own an office someday, or at least be a part of an office or a partnership or something. And it's always important to understand what your unique identifiers are for your office. And so our office, at a time, this is a little dated only because we've just changed our number of offices, but we were at 3 offices in the Bay Area, and we were marketing as Dental Implant Center. So we were technically, at the time that I created this video, we can tout that we're the most comprehensive dental implant center in the Bay Area. We also do start to finish care, and I'll explain a little bit more about that. We have a laboratory available. We have product development and new products always trying to be developed with our patients. We simplify surgical techniques, etc., etc. So the most comprehensive dental implant center in the Bay Area, just for your example as a staff member, yes, we were at a point we were, mainly because there weren't many offices doing what we're doing on a number of level. But I would say ClearChoice, if you're looking at that, they only had 1 office in the Bay Area or 2 offices, but we had 3, but they might be the nationwide brand that you might think about as that dental implant center. However, we're full mouth rehabilitation. That's different than a dental implant center, which is what ClearChoice technically would be, and they're looking mainly as doing just 1 arch at a time. So what does full mouth rehabilitation mean? It means that we do everything a general dentist is trained to do. We just do it in combinations and as a comprehensive plan. So root canals, veneers, fillings, bone grafts, deep cleanings. Many patients don't understand that because on the door they'll talk about on a dental implant center. So they assume that you don't do general dentistry, and that's actually kind of the opposite. We do advanced general dentistry, and we use dental implants as the main feature tool. We will be changing our name away from dental implant centers to full mouth rehabilitation treatment center. So stay tuned for that. Remember that we're also looking for long-term care and providing trusted value with each and every patient that comes in the door. Well, what does start to finish care mean for us, and what is that important? Well, a lot of offices refer out for surgical procedures. We do not. I think that's a huge value to a patient. Patients hate going to other offices, as well as they hate having to figure out what the new financial situation they're going to be in when they do go to a new office. So we don't typically refer our patients out to other offices. So some of the benefits of start to care finish: we decrease treatment confusion for the patient. We have continuous care with the provider. We are 100% responsible for that care. And we learn about the outcomes. That's something that people don't realize. If you do 100% of the work from start to finish, you learn mostly about the outcomes of things. And when you do it all in combination and patients don't get referred out, that means that we can create a more affordable plan for them as well. Laboratory integration: we do have many lab tools available to us, and because we do full arch type of prosthetics, that means we do a lot of full arch temporaries, which are very expensive if we send it out to a lab as well. So to keep the pricing down and keep the quality high and learn about it all from start to finish, we overall can give better service, faster, better, cheaper. Unfortunately, the schedule doesn't allow as much speed these days because I keep becoming overbooked over and over again, week after week. So it's harder and harder to bring in more patients with new patients, but then existing patients that need to get in, even though the laboratory only takes a day or 2 to get completed. It might take a week or 2 for them to come back for that laboratory work to try in and finalize their cases. Cheaper isn't what we're talking about. We're not talking about quality. We don't like to redo work at all, and so we always try to buy and always do buy the highest quality product we can for any patient that we see. So, product development. This goes up and down, but because we own a laboratory in the clinical offices, we're in a unique position to create a better system and products for better outcomes at a lower price point for patients. So yes, this is true. We do and create hybrid dental prosthetics, for an example, in 3 different types, and can actually save patients quite a bit of money. We do like to offer multiple choices and not just one clear choice for one particular procedure. So we like to streamline the planning and the delivery systems of things, and we do have proprietary things that we operate under. And our office has also streamlined a bone graft material to be a safer, more predictable type of sinus graft as well. So this is where surgical techniques come in. This turns into trademarks and things that we like to do. We do have a trademark for something called Sinus Secure that we like to do then a lateral type of sinus lift, which we'll discuss at a later date in a more advanced level of these talks. This talk is mainly just to mention a little bit more about what our uniqueness of our office actually is. So when patients ask about our office, about a why or why would they be coming to our office, at least you know a little bit more why they should come to our office. So if somebody's asking you about our office as a friend or a family member, then you would know why they would need to come. And here are those few reasons why, and thank you.